Understanding melanoma. Melanoma is a type of cancer that begins most often in the skin. Less frequently, melanoma can occur in the eye or in mucous membranes, such as the nasal passages, mouth, throat, vagina, or rectum. Melanoma develops in cells called melanocytes that give our skin its color. It is the most serious form of skin cancer because it can spread to any part of the body and could become fatal. The spread of cancer is referred to as metastasis. The skin is the body's largest organ, with a total area of about 20 square feet. The skin performs many functions. It is a barrier that protects us from germs and the weather. It helps regulate body temperature. It allows us to sense heat, cold, touch, and pain. Lymph nodes, small organs made up of clusters of different types of cells that belong to the immune system, are located throughout the body. Some are close to the skin, others are in deeper tissues. When melanoma starts to spread, it often travels first to a nearby lymph node and grows there. Cancer starts when cells become malignant. That is, they start to grow and divide uncontrollably, forming a tumor, and gain the ability to spread to other parts of the body. Melanoma is caused by melanocytes that have become malignant. Ultraviolet or UV rays are a major cause of melanoma. Most UV comes from sunlight. UV rays can also come from other sources, such as tanning beds. UV damages the genetic material or DNA in melanocytes and skin cells. This causes changes in the genes that control how the cells grow and divide. Over time, these cells may become malignant. The damage to DNA may occur many years before cancer develops. Some gene changes that increase risk for melanoma run in families. These gene changes are called mutations. Around 1 out of every 10 people who get melanoma have at least one close relative, such as a parent, child, or sibling, who also had melanoma. A parent with a mutation has a 50-50 chance of passing it on to a child. The most important sign of melanoma is a new spot or mole on the skin. A spot that is changing in size, shape, or color. A spot that bleeds, or an ugly duckling that looks different from other spots. Doctors call spots like these lesions. A lesion is an area of abnormal or damaged tissue. Other signs to look for are a sore on the skin that doesn't heal, or a mole that's red, swollen, itchy, tender, bleeding, or painful. Look for these signs when checking moles on your skin. A. An asymmetrical or irregular shape. B. An irregular or uneven border. C. More than one color in the same lesion. D. A diameter bigger than a pencil eraser, about 6 millimeters. E. Evolution or change in the size or color of a mole. If you notice any of these signs, make an appointment right away to have a dermatologist or primary care physician examine your skin. Staging is a system for describing the size of the main tumor, whether it has spread, and if so, how far. Stage 0 melanoma is confined to the top layer of the skin. Doctors call it melanoma in situ, which means in its original place. Stage 1 or 2, or local melanoma, is deeper than stage 0 but still confined to the skin. It starts between the outer skin, or epidermis, and inner skin, or dermis, and can spread into the inner skin. In stage 3, or loco-regional melanoma, cancer cells have spread to nearby skin or to lymph nodes. In stage 4, or advanced melanoma, cancer cells have spread to distant parts of the body. Research suggests that 9 out of 10 melanomas are caused by too much UV exposure. You can prevent melanoma by using safe sun practices when you are outdoors. Seek shade. Try to confine outdoor activities to before 10 a.m. and after 4 p.m. The sun's rays are strongest between 10 a.m. and 4 p.m. Avoid getting sunburned. Use a broad-spectrum sunscreen with a sun protection factor, or SPF, of at least 30 every day, even in winter or when it's cloudy. And don't forget to reapply sunscreen if you are swimming or sweating. Wear protective clothing if you will be out in the sun for a prolonged period of time. This can include a long-sleeved shirt, long pants, a wide-brimmed hat, and sunglasses. Avoid tanning, whether intentionally or unintentionally, and stay away from sun lamps and tanning beds. And finally, you can be proactive in preventing melanoma by examining your skin carefully once a month. If you see anything that concerns you, make an appointment right away to have your primary care practitioner or dermatologist examine your skin. Diagnosing melanoma. Melanoma is usually diagnosed by a dermatologist, a doctor who specializes in skin diseases. Your doctor should carefully examine your skin, including the more private areas, to look for unusual changes. Your doctor will assess the size, shape, color, and texture of all spots on your skin, especially any ugly ducklings that look different from their neighbors. Your doctor may do a biopsy of any suspicious-looking mole. They will remove all or part of the mole and send it to a lab, where it will be looked at under a microscope. In a punch biopsy, the doctor uses a pencil-like tool to remove a mole and the layers of skin directly underneath it. In an excisional biopsy, the doctor uses a small knife called a scalpel to remove the mole and some of the normal skin around and below it. After the biopsy, you will get a detailed report of its results. This is called a pathology report. Some of the things it will tell you are, were cancer cells found? If so, what kind? And how far have they spread? How deep is the tumor at its thickest point? This is called the Breslow depth. How deeply has the tumor penetrated the skin? This is called the Clark level. This is not the tumor stage. We'll get to that in a minute. Doctors no longer use the Clark level to predict a patient's outlook, but it is still usually included in the pathology report. How close does the tumor come to the edge of the skin sample? This is called the margin. How many cells in the skin sample are actively dividing? This is called the mitotic count, or mitotic rate. A higher number means that more cells are dividing. Is there ulceration? This is when there is a separation of the outer and inner layers of skin and may be associated with bleeding. Lymph nodes are part of your immune system. Hundreds of them are located throughout your body, with many found in the neck, armpits, elbows, and groin. Lymph nodes are small organs that contain and store large numbers of lymphocytes, white blood cells that help the body fight infection and diseases, like cancer. A lymph node biopsy is done to find out if melanoma has spread from the skin to nearby lymph nodes. All or part of a lymph node is removed and sent to a lab to be looked at under a microscope. In a fine needle aspiration biopsy, the doctor uses a syringe with a thin, hollow needle to remove tiny pieces of a lymph node. In a sentinel lymph node biopsy, the doctor injects blue dye into the area around the tumor. The lymph nodes that get stained with dye are the ones that melanoma is likely to spread to first. The dye-stained lymph nodes are removed and tested for cancer. In an excisional lymph node biopsy, the doctor makes a small cut in the skin to remove an enlarged lymph node. The node is then tested for cancer. Imaging tests may be done to look for cancer cells throughout the body. An MRI scan uses radio waves and magnets to create detailed pictures of areas inside the body. A CT scan uses a computer linked to an X-ray machine to make 3D pictures of areas inside the body. In a PET scan, you will be given an injection of a small amount of radioactive sugar. A special camera makes detailed pictures of the areas inside the body where the sugar collects. Cancer cells absorb much more of the sugar than normal cells do. An ultrasound scan uses sound waves to form pictures of tissues and organs on a computer screen. Staging is a way of describing how much cancer is in the body and how far it has spread. Doctors do this using a system known as TNM, which can predict a patient's outlook. T is for tumor depth in the skin. N is for spread of the cancer to nearby lymph nodes. M is for metastasis, or spread of the cancer to distant skin or other organs. Doctors combine the T, N, and M to get an overall cancer stage. Stage 0 melanoma is limited to the top layer of the skin. This is also known as melanoma in situ. The chance that it will spread is extremely low. Stage 1 melanoma is limited to the skin and is at most 2 millimeters deep. Stage 2 melanoma is limited to the skin and is more than 2 millimeters deep. Stage 3 melanoma may be any depth, and the cancer cells have spread to nearby skin or lymph nodes. Stage 4 melanoma is metastatic. The tumor may be any depth, and the cancer cells have spread to distant lymph nodes or organs, such as the lungs, liver, brain, bones, and intestines. Treating melanoma. Surgery to remove the tumor is the standard treatment for early-stage melanoma. The procedure is called a wide local excision. The surgeon cuts out the tumor as well as some normal skin around the tumor's edges. This is called the margin. Sometimes the surgeon will do a sentinel lymph node biopsy first to see if melanoma has spread to lymph nodes near the tumor. Sentinel lymph nodes are the ones that melanoma is likely to spread to first. If cancer is found in the nodes and the sentinel nodes are enlarged, the surgeon will remove all the lymph nodes near the tumor. Otherwise, the surgeon will remove just the sentinel nodes. Surgery may cause side effects such as bruising, scarring, and short-term pain and swelling. Surgery to remove lymph nodes may cause swelling or lymphedema at the site where the nodes were removed. In some cases, this might be permanent. Lymphedema may cause discomfort, skin redness, and stiffness in nearby joints. Tell your doctor if you have lymphedema. Treatment can help. Immunotherapy uses the body's immune system to fight cancer. Unlike chemotherapy, immunotherapy does not kill cancer cells directly. Instead, it stimulates the immune system to recognize and attack the cancer cells. Immunotherapy is a kind of precision medicine, treatment that is tailored to the individual features of your cancer. Checkpoint inhibitors are one type of immunotherapy. Inside cancer cells are proteins that put the brakes on the immune system. These proteins act as checkpoints that stop the immune system from attacking the cancer. Checkpoint inhibitors are drugs that take off the brakes and allow the immune system to release special cells called T cells to attack the cancer. In melanoma, checkpoint inhibitors block proteins called PD-1 and CTLA-4. Several other kinds of immunotherapy drugs may also be used to treat melanoma. The side effects of immunotherapy may include flu-like symptoms, diarrhea, fever, feeling tired, and gaining weight. Targeted therapy uses drugs to attack substances produced because of abnormal genes in the melanoma tumor. Like immunotherapy, targeted therapy is a kind of precision medicine. About 6 of every 10 patients with advanced melanoma have a change in a gene called BRAF. Some others, especially if the melanoma starts in the mucous membranes, have a change in a gene called c-KIT. Your doctor should test your tumor to see if it has these changes. This will help the doctor decide what treatment might work best for you. The side effects of targeted therapy may include chills, fever, feeling tired, itching, rash, joint pain, development of new precancerous skin lesions, and extreme sensitivity to the sun. Radiation therapy may be used to treat melanoma symptoms. A type of radiation therapy called SRS may be used to treat melanoma that has spread to the brain. SRS uses special equipment to precisely deliver a single large dose of radiation. The side effects of radiation therapy may include swelling, body aches, feeling tired, and skin burning and other skin changes. You may also be at higher risk for getting a second cancer. Chemotherapy is rarely used for melanoma now that newer treatments have been developed. Vaccines for cancer, including melanoma, are a type of immunotherapy. The idea is to stimulate the immune system to recognize and kill cancer cells before they form a tumor. Vaccines for melanoma are being tested in clinical trials. As yet, no vaccine has been approved to treat melanoma. Ask your doctor if enrolling in a clinical trial of a melanoma vaccine might be right for you. Be sure to talk with your healthcare team about any treatment side effects you are having. Many side effects can be treated or avoided. A dietitian may be able to help you keep a healthy diet while you are being treated for melanoma. It's normal to sometimes feel sad or anxious after a melanoma diagnosis. Speaking with a counselor may help.